Welcome to a Johns Hopkins personalized care webinar on managing symptoms of seasonal allergies. Before we get started, we'd like to provide some user tips so that you're comfortable using the platform. The first 20 minutes of the webinar is going to include a presentation by Dr. Clever and Dr. Albert. The last 10 minutes or so will be dedicated to our live Q&A session. To submit a question, you can type into the Q&A box and click send. Your questions will be seen by others watching, so if you don't want your name attached to your question, just check send anonymously. We'll do our best to answer all the questions we receive during the Q&A session. You can also email questions and feedback to personalizedcare@jh.edu. Please note this program is being recorded. At the end of the webinar, we greatly appreciate receiving your feedback and ask that you complete our survey. A pop-up window will appear at the end of our program for you to complete the survey. All right, and now I'd like to welcome Dr. Sarah Clever and Dr. Michael Albert to begin our presentation today.
Great. Thank you so much, Rachel. For those of you who don't know me, I'm Sarah Clever. I'm one of the two concierge physicians here, initially from the West Coast, but loving Baltimore for 23 years now. Mhm.
Yeah, Mike Albert. Thanks everyone for joining. And I am originally from Philadelphia, as many of you know, who are my patients, but I've been in Baltimore for longer than then, since 2000, for training and afterwards. So I now consider myself native, almost.
Great. All right, so just wanted to go over what we will be covering today. As you know, it's a presentation on managing seasonal allergies. We're going to talk a bit about what causes allergies, spend a lot more time talking about treatment options, including self-care, over-the-counter, and prescription medications, some special considerations, particularly for older patients as we manage allergies, and suggestions on when to seek medical care. So go ahead, Mike.
All right, thanks, Sarah. And so I drew the short straw, so I'll go to a little basic science for all of you, which is fun. And the trouble is we have some physicians that are our patients and we have non-physicians. So I'm going to go right down the middle so my physicians can scoff at the simplicity and the rest of you, maybe I can confuse you a little bit. But, this is a good diagram of what's going on. And so really to break it down, seasonal allergies happen when something enters our body and we think of it as an invader. So we'll talk about pollen, which is a harmless environmental particle, but our body ultimately misperceives it, and that's when you end up, not feeling great. So pollen enters your nose or your airways, and then specialized immune cells then process these particles and present them the antigens. So antigen is the word we use. It's basically like a protein or something that we recognize, and it presents it to our lymphocytes, which are our white blood cells. And then in people with allergies, right, this leads to the production of a certain type of antibody called IgE, and they attach to the surface of these mast cells. So the IgE takes them, puts them to the mast cell, and that's a type of immune system that's in a lining of our nose, our eyes, and our respiratory tract. So that's great. That sensitizes you. Next time you encounter it, which is pretty much your next day of allergy season, if you're unlucky, if you've moved to the area, what happens is it binds to the IgE antibodies on the mast cells, and that triggers them to release all of these inflammatory chemicals. And the most important of these is histamine, as you can see in the middle. You may also know there's a couple other ones that can contribute, like leukotrienes, and there's some secondary ways to treat those, and prostaglandins also are involved. But histamine's the big one, and I think that's, everybody's heard of antihistamines, which obviously are a big part of what we talk about. But that's really what happens. And then, what does histamine do? It causes small blood vessels to dilate and become leaky. They don't leak blood, but they leak fluid, and that's what causes swelling. So, what do you notice? Obviously, swelling of your nasal tissue, lots of watery secretions, lots of like clear mucus, right? It also stimulates nerve endings. That's why you feel sneezing and itching. And then the combined effect of all of that leads to all of the symptoms you have. Runny nose, nasal congestion, itchy eyes, sneezing, cough or throat irritation. But histamine release also affects your skin, so you can get hives. It also affects your stomach, so hence abdominal pain and diarrhea. We have a lot of histamine receptors in our stomach. And then, of course, our hearing can also be congested for a bunch of reasons, some of which has to do with nasal congestion, and then the fact that our ears don't equalize, like eustachian tube dysfunction. So, really just to distill it down, Allergy symptoms are your immune system activating an inflammatory response against something that's actually harmless. And in some ways, it parallels, and this is what some of the nuance of what Sarah and I will get into is the nuance of how do you recognize allergies versus, seasonal colds or other things, because there's a lot of crossover. And, as you know, our body overreacts to viruses too. So perfect segue.
Yep. Right. So this is a question that I get from time to time. Is it allergies or a cold? There can absolutely be spring colds and fall allergies. So they do overlap. Allergies only, the predominant, just as Mike was saying, the kind of clear classic symptom is itching. And that is unlikely to be part of a viral infection. So watery, itchy eyes, itchy ears and throat, uh, wheezing. And the symptoms, those symptoms tend to last longer than one would expect from a cold. Colds typically last, 1 to 2 weeks. Some of you might say, but what about me? They lasted 6 weeks. Yes, that has been the flavor of this year's colds, unfortunately. Both can have runny nose, congested nose, stuffy nose, sneezing, fatigue, and coughing. For a cold, the symptoms that really differentiate it, fevers and chills are not typical of allergies, occasionally, but really unusual. A sore throat or a scratchy throat, that's something that's actually painful. Body aches and pains, also not typical of allergies. And again, the shorter duration of symptoms. So then,
Yep. And then we'll talk a little bit about self-care. And I actually should remember, I don't think we mentioned at the beginning, if you have questions as you go along, there's a chat, write them
yes.
in there. Sarah and I have deliberately made sure our talk leaves plenty of time for question and answer. No question is silly, and even if we've answered it, we'll answer it again. So feel free to type as we go. We probably won't look as we're going, but we'll certainly make sure we go at the end and go through them. So self-care, reducing pollen exposure, and I chuckled when we were putting together these slides, or when I read them about it. It's absolutely true. Keep the windows closed on high pollen days. And the reason I chuckled is I don't know if any of you saw the article on this practice called Lüften, which is a German custom of
Oh,
they say open your windows in the winter to let your house air out for
yeah.
5 to 10 minutes. I read it, I think it was in one of I read it and I had never heard of that. And it's apparently a really healthy thing to do right up until it's pollen season in Maryland, in which case you should stop your practice of Lüften if you're doing that. And if I've butchered the pronunciation, then that's how it is. So basically, yes, this is the time that airing out the house is really not a good idea because pollen comes in, sits on surfaces, and you'll be miserable. Use air conditioning with clean filters, and again, your HVAC people will want you to use filters, and I know this because we just replaced ours. They'll want you to use much air filters that pass through more air because it does make the system more efficient. And if you're prone to allergies, this is the time to put like a HEPA filter in. They do restrict airflow a little bit, but they will really make a big difference if you're prone to suffering, because at least when you're sleeping and all of that, it can be really a big deal. Probably goes without saying, but showering and changing clothes after being outdoors. If you're the morning shower, but you love your evening walks during allergy season, you'll wake up a lot happier if you shower again, even a brief one, just to get the pollen out of your hair, off your skin, and certainly the clothes as well. And then the early morning outdoor activity, that's like a lesser known one, but for those of you who love early morning walks, plants, most pollen drops like between 5 and 10 a.m. It's just what they do. And then the cool layer of air actually traps it. It's as the day warms up, convection currents sort of take the pollen away, or breeze does, and the plants sort of stop with their pollen. So there's a bunch of reasons. I butchered the botany for those of you who are experts, but that's the early mornings when there's the most pollen in the environment. So, as much as that's a really nice time to get outside, if you're prone to it, that's going to be the most miserable time.
Right. So there also are some things you can do once you've tried to leave the pollen on the outside that you can do to improve indoor air quality. Mike touched on using HEPA filters for the AC system. There are also HEPA air purifiers, of course, and those can be helpful. Vacuum with a HEPA filter vacuum. And then I was interested to see wash bedding weekly in hot water. Of course, any filter is only going to work as well as its lifespan. So it does require changing them regularly. I always wonder, so they're telling me to change it this often, but they're the same people who are selling the filters. But during allergy season, I think it's certainly worth keeping up on that. Yeah, it is important to have the filters sized appropriately to the room that they're in. I'm not trying to do a product placement at all, but there is a company called Oransi, Oransi, that makes filters that they will actually help you. You can describe the size of your room and the layout, and they will help you figure out if you should have one big one in the middle or three smaller ones. And that's been very helpful for a friend of mine who's a particular allergy sufferer.
And then self-care. I mean, these are all, I mean, self-evident as they are, they make a big difference. So remember earlier on when I was trying to muddle through the basic science, we talked about the leaky blood vessels. You lose a lot of fluid when you have allergy symptoms, and keeping yourself hydrated actually helps your immune system and your body help regulate itself. So just know that you can double, your insensible losses. The amount of, like, maybe not doubling, but you can lose a lot more moisture of just breathing. So sorry, I use that term insensible losses. We interchange them as physicians. It sounds silly, but as a human, there's a certain amount of moisture you just lose by being a plant in a room, just sitting still. You lose a lot more the more you exercise, you lose a lot more in a hot day, but we often forget that there's a baseline moisture loss, but that is increased significantly the more congested you are. So hydration is not just something we push for pretty much a panacea for everything. It is truly important for this. Saline nasal rinses actually do a great job of helping keep your nasal passages open. So as far as like non-medicinal things, they're essentially harmless and can really help. A lot of people really swear by them. No doubt you can do that. I mean, some people love neti pots. I'll say we didn't put a slide on this. I think I consider it drowning yourself. Others consider it very therapeutic. But certainly sinus, nasal rinses with saline can also be effective if you're so inclined. And then often forgotten, but cool compresses for itchy eyes. You can use cucumbers. You can use these, beautiful masks you can get, but they help, like a cool compress also helps your blood vessels sort of shrink down because of the cool, and that helps reabsorb some of the fluid. So you can't really pack your nasal passages with ice that I know of, but you can certainly put cool, even a cool washcloth over your eyes will make a huge difference when you go to bed and how your eyes then sort of like kind of re-regulate and you wake up a little more comfortable.
Mm-hmm. Yeah, and just one thing to add, if people do choose to use a neti pot, it's really important to either use boiled water that has
Mm.
cooled, boiled for 3 to 4 minutes, or use sterile saline, which you can get at drugstores, or just purified sterile water. My thinking about neti pots was changed after I saw a report of somebody who'd used well water for their neti
Ooh,
pot and ended up with an amoeba in their brain, which is terrible, terrible. So
that's beautiful.
over-the-counter medications, there are quite a few. They're first just for your eyes. And eye itching can be one of the most annoying symptoms of allergies. There are antihistamine drops for itchy, watery eyes, and there are lubricating drops for irritation. One thing to be cautious of is there are eye drops that they may be, sold as soothing and gets the red out. Getting the red out means that the eye drop has in it something that makes the blood vessels clamp down, which is okay if you're on a first date, going to prom, you want to look nice, the wedding, whatever. But used over time will actually, when you stop, cause rebound redness, which can be problematic. So stay away if you're just looking for symptom relief of the itching or gritty feeling. Use the lubricating drops and the antihistamine drops, but stay away from the ones that say, brighten your eyes, get the red out. Those won't help as much in the long term.
Yeah, absolutely. And that's a good segue into some of the other things you can do, especially more of the nasal symptoms. So nasal corticosteroids, brands that people know, Flonase is probably one of the most common ones. That's the flowery smelled one. Nasacort, Rhinocort. There's a bunch of them, and you can get them over the counter. Some of them can be prescribed as well. And they do work incredibly well for nasal symptoms. They also do help eye symptoms, so that they actually have been proven to reduce allergic conjunctivitis. So it's sort of paradoxical, how would a nasal spray help, but they can help. And so some people who don't want to take anything orally will find these to be by themselves sufficient to use them. And they really should be used daily. Most of them are two sprays in each nostril, once daily. Some people go up to twice daily. There's risks, the more you go, the more there's risk of potential irritation, but they're really effective, the nasal corticosteroids. Then we get into like the rescue meds, and so decongestants. And so it's interesting. I'll touch on the ones people think about, like oral ones. There's Sudafed, right? And so Sudafed, first off, if you know, the Sudafed PE, which is what's on the shelves now, which is phenylephrine, has been roundly basically disproven to be at all effective in the literature, but yet it's still sold, which is really interesting. So phenylephrine is not very strong of a decongestant, and it was really a response to the original Sudafed, which is pseudoephedrine, which, as most people know, has some secondary market, sales for that. I think the ability to make meth out of it. So that was the one you have to give your driver's license to buy behind the counter. But that's the one that, while it works, it's it's insomnia in a pill, and it's also going to boost your blood pressure. So, mindful that, I think, much to the point of like using Visine or one of those eye drops that helps whiten your eye, you need to rescue yourself. By all means, take a Sudafed. Like, you're giving a talk, you have to do this, get some Visine and some Sudafed. The collateral for it isn't going to hurt in a day. And it's a lot like Afrin, which is the nasal version of Visine. Okay, before you get on a flight, so your sinuses don't feel like they're going to blow apart from the congestion. But if you use it more than a couple of days, you'll get rebound congestion, and then you can become dependent on it, much like you become dependent on Visine to keep your eyes white. So, those are the two brands, Visine and Afrin. Some of them people have heard me recommend it, and it's really you just need to clear things out once.
Mhm.
Use this, try it, a therapeutic trial, but it's not your maintenance med. But nasal corticosteroids are perfectly fine to be used daily. Again, it's always nice when allergy season is over to try to get yourself off of anything you're taking to avoid unintended consequences, but they are safe to be taken for weeks and weeks and weeks, and they often are effective that way.
Great. Antihistamines, there are a variety of different ones. There's the older generation, Benadryl, which is diphenhydramine. I'm sure it comes under other brand names as well. Some people do not get drowsy with Benadryl. I have met them. Most of the rest of us do. So that's what's so nice about the second generation ones, which are cetirizine or Zyrtec, loratadine, or Claritin, and fexofenadine or Allegra. They are less sedating, not completely non-sedating, and they are also safer for long-term use.
Yep. And these are the special considerations. I mean, the first generation antihistamines, Benadryl, and chlorpheniramine is the other one. I forget the brand that it used to be. It's been a chlortrimeton, I think, was one of the
Oh,
ones.
I think that's it.
Yeah, I remember taking it during biochemistry as an undergraduate and falling asleep. I mean, it's all we had for allergies back then. So now that was also because of biochemistry. But these, besides making you drowsy, they're really risky in the older population. And I think we know they cross the blood-brain barrier, so they get into your brain, and they've been proven to cause confusion, delirium, falls, and then the urinary retention and constipation. Terrifying, right? Heart rate and blood pressure effect. So we recommend everyone avoid them. And by the way, that is the ingredient in Tylenol PM or Advil PM. So the thing that makes them sedating also doesn't get you real sleep, and it really can affect your brain functioning. So plus you're taking unnecessary painkillers. It's a nice marketing thing to say take Advil with Benadryl, but really none of them. It's a med that really shouldn't be used outside of like severe allergic reactions. And even then, some allergists are recommending Zyrtec or cetirizine in lieu of Benadryl for allergic reactions, even in those who carry an EpiPen. It's not that I'll leave to allergists to make recommendations or
Yes.
specifically before you switch away from Benadryl if you're somebody who has anaphylaxis risk. But the bottom line is, for allergies, these really should be avoided.
Yep. Yes. And safer alternatives for older adults. I know there was a question that came in, do the concerns about cognitive impairment apply also to younger individuals with the first generation antihistamines? And I have not seen data, I couldn't at least quickly find data that suggests that. Most of the studies have been done in older adults. And just to emphasize, the first generation antihistamines do increase the risk of dementia, which really gets people's attention. So to avoid that, second generation antihistamines, like we were talking about, nasal corticosteroid sprays. Tip that I learned in the elevator with an ENT is that we're supposed to aim for our nose, or for our ear rather, aim for the ear when we're spraying this in, and not you think you just spray straight up. No, it's aim for the ear on each side. Saline rinses, like we talked about, avoid the well water, and non-sedating eye drops. I don't think any of the eye drops are sedating, but the non-vasoconstricting eye drops.
Good, good. And then alternative remedies. I mean, we always want to see what else is possible. And among many, 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 many other great things that may be proven about acupuncture, I mean, but actually, one of the things that's out there that actually does have a lot of poorly understood benefits, but very positive acupuncture. So for people who are really refractory to the meds or just feel miserable in allergy season, I think it's always worth, if you're amenable, considering acupuncture because it's been shown in some studies, right? And it's actually shown in some studies, to well outperform the medications. And even needle phobes like me could be desperate enough to go do that, but that's certainly an option. And it's really interesting because I think a lot of what acupuncture does, or what we believe with how it modulates your nervous system, is particularly your autonomic nervous system, is fascinating. I mean, the part and the other part about the balance of bacteria in your nose, again, how does that work? We don't know, but the fact is it is in trained hands harmless, we think, and also has some great benefits. It's something to consider. Honey, very tasty, hasn't shown much benefit. If it soothes your throat and keeps you from coughing, feel free. But otherwise, not much to it.
Yes. Some other alternatives that you may come across. I'm sure a few of you have searched the web for answers, maybe only one or two, but one that I had been unaware of, but apparently is touted for relieving allergies, is butterbur. Unfortunately, the scientific studies that have been done are unconvincing. And what really drew my attention is that there are safety concerns due to I practiced this before, pyrrolizidine alkaloids that may contaminate butterbur products, which can produce liver damage. So if you decide to try it, or if you have found that it works for you, just make sure that the formulation that you're using is very carefully purified so as to avoid the liver toxins. Probiotics also, I'm having a hard time thinking of something that probiotics haven't been recommended for at some point. The studies show that they may improve overall quality of life and nasal symptom scores. There are some specific mixes, combinations of different ones, bifidobacterium, lactobacillus, that together have studies done comparing the bacteria to placebo, have shown that they do improve quality of life and nasal symptom scores. But again, you have to be very careful knowing who's supplying it.
Yeah, that's always the case with supplements, but there
Yep.
might be benefit. It's interesting. Prescription options. It is such a blurred line as more and more things come over the
Mhm.
counter, and so that's what's really interesting. And so, luckily, most people can medicate themselves without needing prescriptions. Even things that used to be only prescription aren't anymore. So, prescription nasal sprays, the combination ones, there's Dymista, I think is the brand name, but it's basically azolastine plus Flonase. And both of those are actually available individually over the counter, right? So azolastine is Astepro. So, it's really hard. These are things we probably should circulate a handout so we can say, if we, I guess I've just conscripted myself to do that, but give you what the different categories are and what the names are, but you can find these different categories of meds over the counter. But basically, Dymista, I think, is the brand of the one that's a combination of a nasal antihistamine and a nasal steroid. Prescription antihistamines, there's very few anymore, but I mean, ones that you'd want to use, but hydroxyzine or Vistaril, kind of sedating. We sometimes prescribe it for anxiety, but it's really doesn't really have a great place given so many other choices. I think Clarinex, which is desloratadine, it's a just a slightly more, I guess, purified version of loratadine due to only one mirror image molecule of it. That's, I think, still prescription, but I think it might be over the counter. And Xyzal as well is the version of Zyrtec, but that also is now over the counter, I believe. So, what's prescription is becoming less and less restrictive. The key really is obviously trying to figure out what to take because, like all shelves in the pharmacy of over the counters, it's sort of the number of remedies is probably inversely proportionate to the success of any single remedy, right? If there's one that worked for everybody, there'll just be one category, so it can be overwhelming walking in there. Things that are prescription leukotriene modifiers like montelukast or Singulair. That's what helps. That's as an additional one. So people who are really severe who often be using a Flonase and a Zyrtec and are still suffering. Sometimes Singulair on top of that can help. A little more tricky with side effects and medication interactions, which is why it's good that it's prescription, but is another option. And then if you're, really struggling, allergy shots are, can be very, very helpful. Immunotherapy, and there's people, especially in a place like Maryland, there's obviously a good place for that as a semi-curative process, albeit one that's fairly time intensive. And we do, I think it's known to most of our patients, but Hopkins reopened their allergy clinic here on the Green Spring campus where they're actually giving immunotherapy, which is great because it used to be for a while just at Bayview. But there's other allergists in the community. But if you would like referrals to our team here, that I think they're doing pretty well with getting people in for allergy shots, should you want that.
Yep. When to seek medical care? Certainly, if symptoms are interfering with sleep or daily life, we are here to help you with that. You've tried the over-the-counter remedies and they're not enough. If you're unsure which medications are safe, Mike mentioned, possibilities for drug interactions. Most of the over-the-counter ones, that's not an issue, but it's always worth checking. And certainly, if you're having wheezing or shortness of breath, we absolutely are here to help you with that. So there we go. Mike, take it off.
Yeah, key takeaways. I mean, so really lots of options. Experimenting is reasonable from the list we gave you because there's no one, everyone will say there's this works for me and really finding what works for you is key. Some people, even between Claritin and Zyrtec, some people find one more, Claritin perfectly helpful, Zyrtec sedating. So, we can certainly help guide you. I think consistent treatment and self-care, the things we said early on, try to reduce your exposures helps a lot. Definitely look at medications when, especially as you accumulate pills if you get older, or just as you age, these things that used to be safe or easy may not be, and we're happy to help. And by all means, reach out to us. These are easy wins for us to help you. We're happy to go through this with any of you.
Great. And that's a wrap.
Yep. So,
And we're happy to answer any questions. Okay. Can you comment on cautions with daily use of anticholinergics? Does it depend on the age of the patient? So that was one that we had touched on. And yes, certainly a concern for patients as they get older. I would say 65 and older. Like I said, I couldn't find anything about. I couldn't find any studies done in younger patients, but younger patients don't tend to get dementia, so it's a harder thing to study. And the best alternatives really depend on the individual. It could be the kind of more self-care things, nasal saline rinses, acupuncture, or come talk to us and we can help you pick out something that might be a prescription strength medication.
yeah, definitely. Anticholinergics, Benadryl has anticholinergic effects, which is why we don't love it. The other ones we talked about, Allegra, Zyrtec, Claritin, do not, so that's why they're okay. And that's actually a good segue to question two. Best
Mhm.
solution you found is Allegra, I assume, due to no drowsiness. And that's actually true. This is very variable by person, but if you look at the big three, and I'm going to use the brand names just because it's easier, and I think people have this visual, but Zyrtec or cetirizine most commonly is the most potent of the non-sedating three. So Claritin or Clarinex, Allegra is in the middle, and Zyrtec might be the strongest. But there's also, I think more people anecdotally find a little bit of drowsiness with Zyrtec, middle ground with Allegra, and Claritin less. So, really, Claritin's the weakest, maybe Allegra's middle ground, Zyrtec's stronger. So if you're an Allegra user and you don't get response, you could try Zyrtec. It's not supposed to sedate you, but maybe 1 in 15, 1 in 10 might find it causes drowsiness, in which case bump down to Allegra, see if that works for you. And then if you were unable to take Zyrtec or if it doesn't work, I would add a nasal spray to that. The two of them work like peas in a pod. So, often it's an antihistamine plus a nasal corticosteroid. I personally like Nasacort because the flowery smell of the Flonase I don't love it. Everyone's got their brand. I can't tell you anything works better.
Okay. Mentioned Montelukast in combination with other OTC drugs. Why not use Montelukast alone as daily maintenance for allergic rhinitis in the high pollen season? That is an option. There are reports of liver damage with Montelukast, which, anything we do, we want to do it as safely as we can. Balance, obviously, everything we do in medicine is a balance of risks and benefits. And so while the benefit may be enough to, have people use the Montelukast alone, if they can, if they can. I mean, some people just don't tolerate nasal steroids. They get a burning sensation with it. It's all very individualized. But anytime we can get away with, tolerable symptom relief more safely, that will be appropriate, for patients of mine whose asthma is uncontrolled without Montelukast. Obviously, that's what they need to be taking.
Yeah. And if you go back, I mean, since I got stuck with the basic science, just the only thing to add is that histamine is still the dominant chemical release that leads to allergy symptoms. Leukotriene is another one of them, but montelukast or Singulair is only a leukotriene inhibitor. So you'd
Mhm.
be leaving histamine unblocked if you just took that. So if it worked, by all means, I mean that's where it comes down to. If it's the thing that works for you, fantastic. But I would generally recommend an antihistamine first and montelukast only if it fails.
Yep.
What is the hay fever season? Well, yeah, and there's two questions that are really good in here. What is the hay fever season or when is it? Well, it's really when, I mean, it's going to start happening any time now because pollens, you can see things starting to flower. So when you see plants starting to look just think they're looking pretty, that is when typically spring pollen season emerges. But there's spring pollen, there's summer grasses, there's fall leaf mold, and there's trees year round. So really, Maryland being a very seasonal state is a particularly allergic. The Mid-Atlantic region is kind of a hot spot for allergies because we have a lot of really robust pollinators, I
Mhm.
think, and if I know there's a better explanation, but that's Maryland's pretty severe. So other than dry winter, probably could be year round. So if you take medicine every day to fend it off, does their effectiveness begin to decline? Yes, maybe. So antihistamines in particular have the ability to lose effectiveness for some individuals, but not all, as you take them more. So that is one of the issues. And sometimes you can fend that off by switching to a different one. Sometimes a holiday and then getting back on it will help. So generally, I do, there's nothing like prevention, but this is a case where you might want to know you're really in an allergy season before you do this. And that's where some people with really severe benefit from allergy testing with an allergist because that can actually help you target what you're allergic to so you can actually seasonally predict when you really should be taking these meds. So it's a nuanced question, but hopefully that answer helped.
Yep. Is there any common reason beside allergies that my eyes water and nose runs, especially when I'm outside? Yes. It's called vasomotor rhinitis. It can be triggered by cold, particularly. That's why our noses may run when we're outside in cold weather. And there are medicines specific to it that can be helpful. Azolastine, I think, is often used for vasomotor. And Mike, do you have anything else to add to that?
Now
I'm
that's
still,
that's
yeah.
Yeah, I mean I'm trying to think. I mean, there's a lot of things that can happen. I mean, obviously in the winter, just good old cold air will be
Yeah.
often the case, right? But yeah.
Yep. All right. Well, thank you everyone so much
We really appreciate it.
for coming. And happy to, if you have more questions, just email personalizedcare@jh.edu, and we would love any feedback. This is the first time we've done this. And would, be very helpful to have feedback so we can know how to refine it in the future.
Yeah, we'd love to, we take very seriously being available for all of your care, as much as we can. So we don't take it lightly to go offline for half an hour. We're going to look at our phones in a few minutes and see what we missed.
Yes.
But on the other hand, want to be helpful. And so if there's topics you'd love to hear about, email them in
Mhm.
to us, to personalized care email, or just let us know when we see you. We can certainly collate. And if there's a popular topic, we'd love to help out.
All right.
Take care. Have a great weekend, everyone.